Welcome back to the channel. The true story of the Samoa measles outbreak. I see a lot of people on the eve of RFK Jr.'s confirmation hearings talking about his role in Samoa, which suffered in a terrible measles outbreak in 2019. What is his role? What did he do there? Is he responsible? That's what I hear people saying. I had a chance to read through the history of this topic. I read a number of really elegantly written interdisciplinary summaries of the events that occurred, and I had a chance to reflect upon it. And I think the answer is you can't really blame him because the timeline doesn't make sense. So let me just walk you through the bare bone facts, okay? Number one, Samoa, like all these Pacific Island nations, has long had, I think, some distrust of Western medicine, some embrace of alternative and complementary medicine. Measles, in fact, did not even exist in this island before the 1800s, before white people brought it over. So naturally, I think they are distrustful of some of these modern medical things. In 2017 and 16 and 15, they had a bouncing vaccination rate for MMR. The WHO is so bad at collecting this data. See my WHO video, either coming before this or after. They're so bad at collecting this data that even their statistics include people who've self-reported that they gave the kid the vaccine without any proof that they did, so that statistic might be off. But they had a bouncing around rate, and it was, modest and medium, something like 70, 80%. Then, in July of 2018, two nurses drew up the MMR vaccine, but they mixed it with an expired paralytic, rather than saline. They injected it in two babies, and those babies died because they were paralyzed from this big medical screw-up. They took those vials home, and they hid, and they kept secret what they did, and they later were convicted of manslaughter. But what this led to was a huge local campaign that asked why, what happened, and people's fears were through the roof. Let me read you an actual headline, quote, "Two babies die in Samoa hospital minutes after receiving MMR vaccination, investigations underway." And it opens with this text, quote, "The Samoa government has seized the MMR vaccine from around the country and launched an investigation following the deaths of two babies last Friday," end quote. Then the government put a pause on MMR vaccination for 10 months. Okay, these are the key facts. These nurses killed a couple of babies. They were convicted of manslaughter. They tried to hide it. They were fear-mongering messages throughout the media. The government suspended the vaccination campaign. Okay, that's in 2018. From 2017 to 2018, the vaccination rate went from 75% to 30%, according to the WHO's own flawed statistic. Okay. People say that, just to put it in perspective, there are other island nations in the Pacific, like Papua New Guinea, which only has a 37% coverage rate. So MMR vaccination rate has always been, I think, great in some nations and poor in other nations in this part of the world. And this, I think, Sentinel event led to a huge decline and a government response. The government responded. Okay, then the rate is low. In June 2019, RFK Jr. visited, along with others, purportedly for a conference that was regarding vaccine skepticism. By August or September of 2019, just a month or two later, or 2 or 3 months later, measles was thought to be introduced from a visitor from New Zealand, and the outbreak began then. A state of emergency was declared, and then vaccination was doggedly pursued. Okay, one of the reasons why many Samoans died of it is still unclear. I think the case fatality rate is quite high. Some people believe it's that these kids did not seek medical care. They have a broken healthcare system. Sometimes they were given unproven therapies like vitamin C. I'm not saying A, I'm saying C. Listen to what I'm saying. Okay, and zinc and other putative remedies, and this may have increased the death rate. But here's my point number one. Who's at fault? I write in my essay on Vinay Prasad's observations and thoughts, and I want to read it because I think it's the right way to put it. The Samoa measles outbreak occurred because of a constellation of factors, including an impoverished population, a recent history in historical terms of having measles, long-standing poor vaccination rates, the manslaughter of two children, a cover-up, poor health literacy, poor health infrastructure, poor government messaging, suspending the MMR vaccination program by the government, and a country drawn to traditional ideas of health and medicine. It cannot be RFK Jr., okay? It can't be him because he only got there June 2019. The vaccine rate has already been rock bottom, and the rate was so low, the measles outbreak was imminent. The die had already been cast. Him going there, whatever he said, it couldn't have caused it because the damage was already done. It was already primed to be caused, okay? It was already set up. So to me, it makes no sense to link it to him. Now, what did he say when he got there? These are different questions, but if you want to say that he's completely responsible for all this, then I just completely disagree with you. That's just not the facts of the story. And like so many things in medicine, it is in fact multifactorial. You cannot blame just, even if you find, and there are some other people in Samoa who are critics of vaccines, it can't just be those people. It's all of this stuff. It's poverty, it's poor education, it's lack of trust in healthcare, it's longstanding low vaccination rates, and it's the murder of 2 kids and the cover-up. Okay, that's the immediate proximate inciting event. And the government's response was to suspend vaccination, okay? And it took them a while before they actually found the true story, and then they were fear-mongering headlines. It's all of this together. That's why things happen in medicine and public health. It's seldom one third-party commenter, okay? Now, Anthony Fauci is like a central player in the government response to COVID-19, so his role is much larger than Joe Rogan's role in the COVID-19 pandemic because he is just a third-party commenter. And in this case, the time course absolutely does not make sense. RFK Jr. cannot be the main culprit behind this. That's my point, okay? That's my only clear point, is that he cannot be the main culprit. And if you really care about vaccine hesitancy, you're not going to win it by scapegoating RFK Jr. or whomever you want to scapegoat. You want to win it, really win it for generations. You have to invest in honesty. 1, run better randomized trials of novel vaccine products. Your maternal RSV vaccine randomized trial is bullshit. The primary endpoint of vaccine studies has to be reducing the risk of that disease entity, not that disease entity caused by that target virus. I don't want to see lower respiratory tract infections caused by RSV. I want to see all-cause lower respiratory tract infections. I don't want to see CIN2-3 caused by the strains in the vaccine. I want to see all CIN2-3. You have to look at the clinical entity. That's step 1. You have to run big randomized studies, longer randomized studies, get better information about safety, and then you have to invest in a good phase 4 system, not this terrible VAERS that requires passive surveillance and that missed all of the major COVID-19 side effects. Here's what no one says. In COVID-19, which country found out there was myocarditis? The US? Israel in February of 2021. Our own CDC director denied seeing a link in April of 2021. Our vaccine program is so bad, we're missing a catastrophic safety signal. Who found VIT, vaccine-induced thrombosis, thrombocytopenia, and thrombosis? The Europeans, okay? We are so bad. So if you want to build trust in this, you have to do the hard work of making the science better behind these products. And this narrative around Samoa falls apart on first glance, and there's some other ways it's going to fall apart. But I had a really good idea, and I want to write like an original article for a medical journal, so I'm not going to blow my idea on this video, but I will do that, and I will make this point really, really strong in the weeks to come. But if you like this video, you know what to do. Like, subscribe, comment, leave a message below. Follow me on Instagram. Follow me on Substack. That's the only way that we have a direct connection, and become a supporter for this channel. And I'll be back with more videos on all sorts of medical topics, which is my expertise, of course, as a doctor and professor of epidemiology. Until next time.